Well, hi and good afternoon. Thanks for joining us once again for an update on what's happening right across the Western New South Wales Local Health District. I'm Dougal Saunders, joined today by the Chief Executive, Scott McLaughlin, and also Assistant Commissioner and Western Region Commander for New South Wales Police, Jeff McKechnie, all available to answer questions after we've provided some information. I do want to start with a positive again today, and that is that we've got 5 more people across the health district that have now recovered and are non-COVID positive cases. Up until 8 o'clock last night, 35 new cases for the health district, and we know 10 of those have been infectious in the community. For Dubbo, 24. It was reported earlier as 25. One of those cases has actually been known to be Wellington. So that Dubbo number drops to 24. There is 1 case for Wellington. Orange has 3 new cases. Bathurst has 2. Burke also has 2. 1 for Mudgee. 1 case for Forbes. And 1 case in the Parks Shire, for a total of 35 cases across the local area. There have been some adjustments today, so including people that have moved out of the local health district or have been regarded as not being in it, and also some of those recovered cases. So the total now for the health district is 389, and 309 of those are in the Dubbo area. For the Far West, there are still people asking about this each day. So the Far West, Wilcannia has 5 new cases and Broken Hill has 1 new case. Just over 4,600 tests for the region, so unfortunately we're down a bit in the last 24 hours, and Scott will talk a bit more about this as well. But what we do really need you to keep doing is coming forward and being tested with even the mildest of symptoms or any concerns you might have, and those concerns could relate to who you've interacted with, where you've been, or somebody as a second-hand person that you've come in contact with that may have been there. It's all about making sure that your contacts are fairly open and clear about what you're doing, and the main message is you should not be doing very much at all. Essential things are what we're talking about, including essential work and essential food. Other than that, we really want you to be staying home. We also do need you to keep a regular eye on the New South Wales website with those venues of concern. We're constantly working on that. And we're constantly working on ways to make it better and more available to you more quickly and accurately. I will ask Scott also to talk a bit more today about some of the testing capabilities that are increasing. And look, that is definitely part of the solution of getting more people tested, is knowing that you'll get results as quickly as possible. It is a constant thing that we talk about and are trying to fix. So be aware, we are aware that there are concerns around the delays in sometimes getting your test results back. We are doing everything humanly possible to try and rectify that. As far as testing, all of our clinics, of course, are remaining open right now, right through the weekend. So heads up, that will continue. Wellington at the Civic Centre there had a good day yesterday. It's open now 10 till 4 at the Civic Centre at Wellington. Over 170 tests yesterday as opposed to about 80 the day before and less the day before that. So that's good. Please, again, share that information with your family and friends so we make sure all of the Wellington district is aware that that Civic Centre is now the place to go. The vaccination pop-up happening right now. Again, it will continue here at the Dubbo Regional Convention Centre today and tomorrow. So Thursday, Friday, it remains there between 9 and 4:30. Expecting to be moving back to Pioneer Park after it's dried out a bit by Saturday. So the weekend, the final weekend of this ADF Health District pop-up clinic is set to be at Pioneer Park. If you are thinking about whether you should be popping out for a vaccination, now is the time to do it. There is availability at the Dubbo Regional Theatre and Convention Centre today. Again, line up if you have the opportunity, or tomorrow, and Pioneer Park right across the weekend. It's been fantastic. You do need to be prepared, but please, that is one of the solutions to make sure we're all getting what we need, a vaccination. Have your ID or your Medicare card with you if you've got one, your IHI if you don't have that, but some form of ID is absolutely required. We've had some cases where people aren't getting the registration from their Medicare card through to their Gov website updates. Look, most of that is working quite well. So if you are having some problems, get in contact with Medicare to sort that out. The idea is when you take your Medicare card, it automatically updates your MyGov account to show you've been vaccinated. There are some cases where it's not working, so we're certainly working on that. ADF teams are right out and about at the moment, as we know. Again today at Narromine, Burke, Coonamble and Parks again today. And from tomorrow, Brewarrina, Trangia and Peak Hill. So there are lots of opportunities. This is the time to come out en masse and line up to get your vaccine while they're in town. We will have some more details around exactly where the ADF and those clinics are coming up. There's not all of the details, like the times and the exact location for everywhere yet. So next week, we know Mudgee and Golgong and Nyngan, there are no details there yet. That is still being worked on. We'll update you with that as soon as possible. And again, we'd ask you to tell people in your circle that may not get that information. The other thing to remember, and this is a really important part, is if you do go to one of our walk-in clinics and you've booked somewhere else, whether it's through the COVID clinic in Dubbo, your pharmacist locally, your GP locally, please cancel that appointment so it's available for somebody else. So pharmacists are doing an amazing job across the region, but we need to make sure that if you've got an appointment with them and you go to a walk-in clinic, you let them know so they can upgrade somebody else into that spot. This is about getting as many people through as we can, and all of us play a role in making sure that continues to happen. Wellington's vaccination clinic is working extremely well. Caught up with them this morning. It is a booking only service, and that booking service is working really well. So at this stage, that will remain bookings only. 6845 5423. There are appointments available, but they've done over the past few days over 400 now. And working extremely well. But give that number a call if you're looking for a booking. There are bookings available, and this is the whole of the Wellington district we're asking to come forward. Well done to the team that is doing a great job there. And of course, more appointments from the Dubbo COVID Vax Clinic, which was at Monera Plaza, now at the Woolpack Pavilion. Appointments there growing all the time, particularly around the Oxford University vaccine, AstraZeneca. Absolutely trusted worldwide, lots of appointments available there. So make your bookings through that eligibility checker, or you can call on 1800 571 155. Just note that that is bookings only at the Woolpack Pavilion. We've had a few people turning up. It's the entrance off Wingewarra Street near Chelmsford Street. It is for bookings only, so please be aware of that. But of course, GPs, the respiratory clinics and pharmacists, as I've mentioned, AMS is doing a lot of this vaccination as well. We want you to keep in touch and go there if that's going to work better for you. Now look, the other thing, the Premier announced this morning that we will, based on growing concerns around how this is developing, we will be remaining in stay-at-home orders for another 2 weeks. That takes it through until midnight Friday, September 10. Look, that is based on the health advice, and the best advice at the moment is that we are, in this area, we are at the heart of concern. That's a fairly blunt way to put it, but the risk is there for not just our communities but communities near us, and we don't want to risk that spreading more quickly than it already has. So that 2-week extension is based on all of the advice from the Chief Medical Officer and in fact health districts right around the state who are keen to make sure that we don't lose control of this any further. The good news is, what that means is we have 2 more weeks to make sure we get as many jabs in arms as possible. We have 2 more weeks to make sure we get those numbers down. At some point we need to reach the point where we're heading in the reverse direction. That is not yet, but with an extra 2 weeks we can absolutely focus on that, and that's what I'm really asking for your support today to do, as Scott will be as well. This is a health scenario. We need you to play your part in a solution for that. As I mentioned, our region is at the heart of concerns that health officials have. Together we can help change that. A shout out to all of the community groups that are doing an amazing job today, and we've got a list. We'll put up a bit of a list and a contact number for a range of those very shortly. Everything from food and other goods to mental health support. There's transport being provided, a great list of community providers that are doing their bit to make a difference. So thanks for everything you're doing, and you can find a list of those and their numbers going up on our Facebook post shortly. Again, a lot of information that's being provided today by myself, by Scott and also Jeff. If you do have any questions, we would ask that you look on the New South Wales Health website and on our Facebook to find out some information for yourself before you reach out. We're all very swamped. We are trying to keep up and do the very best we can for you to provide that one source of information. Keep doing what you're doing, keep supporting and sharing love with each other, and I'll hand over to Scott now for his messaging.
Thanks, Dougal, and good afternoon, everybody. Well, another day in the progress of COVID around Western New South Wales. We know that COVID is continuing to spread to additional communities. The new case that we have in Forbes, the additional sewage detection in Brewarrina, I think it's time for us to all be really clear that this can be in your household, in your house next to you, in the supermarket or the service station down the road. And so please, for every community and everyone right across Western New South Wales, this is time for us to come together, to do things differently, to stay apart from each other, to stay in your house and get through the next couple of weeks together. I know it's going to be a stressful time. There's certainly every support that we can provide across the region to help us come through this. Now, the numbers aren't all important. We know that how we behave and react and the things that we all do are going to be crucial to get through this together. Vaccination clinics are going gangbusters, and really want to say thank you to everyone that's coming out to getting vaccinated. I know there's been some waits and concerns in different communities, but we're also seeing some places where we aren't getting people come out to get vaccinated. So we've got a window of time here over the next couple of weeks to get everyone across the Western New South Wales vaccinated that can be. So the challenge I'd put out is, if the ADF team is in your town, if you've got a pharmacy, if you've got a GP or our own vaccination hubs, then please source those out immediately. The ADF teams are only here for a short term, and so those pop-up clinics, particularly today in Burke, it's the last day. Please don't miss this window, and please come out quite urgently to get vaccinated. Now, the stay-at-home order is being extended right through until the 10th of September. Will be challenging. We know that there is a lot of support for everyone in place, but it's also the window of time for us to stop COVID in our backyard, and so this is the time for us. So in the last 24 hours, we've seen 35 new cases. We've got a big number of those that are in home in isolation, and so that there's some pleasing signs there, and that's not surprising, knowing that there's people in houses with other infectious people in those houses. Across the whole of Western New South Wales, 25 cases in the Dubbo LGA, and as Dougal mentioned, one of those in Wellington. Orange, 3 new cases, Bathurst 2, Burke 2, Mudgee, Parkes and Forbes 1 each. That new case in Forbes is a real sign that we need everyone in the community to be really vigilant and aware. If you've got any signs and symptoms, however mild, then please come out and get tested. There's some real urgency around this. Out of our total cases, 17 of those have got known links either to household contacts or known links to another cluster. We've still got 18 cases that are under investigation. Our contact tracing teams are working 24/7 to try and make sure that we can track that down as quickly as possible, and so appreciate all of the attention and support to that. Out of the 35, we've had at least 10 of those that were infectious in the community and potentially infectious across a number of days. 12 weren't infectious in the community and 20 are still under investigation. So some of the pleasing signs there is there's more people in isolation, more people staying at home. I really do want to see these numbers decrease in coming days. Again, the age groups for the cases, 41% are aged under 20. Now that's a decreasing number. There's more people aged over 20 that are becoming infectious. So 93% of our total cases are aged under 50, and we've got another person aged over 70. They're actually aged over 80, and so this is the time for us to know that the older people in our communities, the most precious people to us, to our grandparents, our fathers, our mothers, auntie and uncles, are the most vulnerable to COVID. And so please, I'm begging everyone, this is time to protect our most vulnerable and our most loved community members. Everything we do is to keep them safe, and so please take that into everything you think about every day. We've got over 110 venues of concern. That number's grown significantly overnight. Please, everyone, have a look at those venues. Our contact tracing teams are working 24/7, as I said, to try and track down the venues as quickly as possible. Sometimes those venues are going up with a broader time frame. That's partly because of the QR code checking-in, where we haven't got that complete for everyone that's come to a facility. So please don't compromise when you go into a facility. Make sure you check into those facilities with a QR code. And because some of the information is still coming to hand, and so we've wanted to provide that advice publicly as quickly as possible. That'll continue to be refined as we get more information. The new positive sewage test in Brewarrina is of particular concern. We know the connection between communities of Brewarrina, Burke, Walgett and other communities around, and so please, everyone in Brewarrina, if you've got any signs and symptoms, however mild, then please come forward and get tested. We did see again a decrease in testing numbers yesterday by about 20% from the day before. So Dubbo, around 1,900 tests. It's the first day in around 10 days that it's been under 2,000, and so I really would urge people in Dubbo, with the continuing growth in COVID cases in Dubbo, come forward and get tested if you've got any signs and symptoms, however mild. Mudgee 111, Bathurst 430, with 31 tested in Kelso. We've now got a home testing service that's rolling out across Bathurst. That is getting into the homes of people that are either disabled or elderly and can't leave homes, but we're going to continue to scale that up. We know that it's been difficult for people to get to some of the testing services. Orange, 1,062 people were tested yesterday, so thank you to everyone in Orange. Parkes, 245, Wellington, 146, Burke, 105, and Forbes, 91. Now, Forbes, I really would urge everyone in the community, come and get tested today if you've got any signs and symptoms, however mild. Now, our testing clinics will continue right throughout this week and over the weekend. We'll be scaling those up further in locations where we've got particular concerns. We'll be looking in options of how we can scale up some of our in-home testing services, particularly for some of our vulnerable communities. The new technologies are quite exciting that are delivering test results in some cases within 20 to 40 minutes for some machines, 3 to 4 hours for others, and so we're investing heavily in those new technologies to bring into our region. Yesterday, as I mentioned, we saw 3 new devices go into Burke, Walgett and Bathurst that have got a very quick turnaround time. There's more of those being prioritised for our region, and a new device in the next week that we'll see come into Dubbo that's got a big capacity to test bigger numbers of people. It was recently used at the Arena Stadium in Sydney that tested 15,000 people over a couple of day period, and so there's those new technologies that are going to help us get in front of this, as well as some new rapid antigen tests. Now they're being used right throughout the world that are helping people to get tested before they leave their homes or come into a workplace and others, and so there's an expanding opportunity for us in coming weeks with those type of things. What I would say though is don't compromise yourself or your family or your loved ones. If you've got any signs and symptoms, don't mess around. Get tested as quickly as possible. We've got to stop COVID now. We'll keep working on the new testing solutions in future. In terms of our hospitals, we now have 18 patients in hospital, 3 in intensive care and 1 of those ventilated. Now, I can only imagine how scary it is for someone on a ventilator and their family. But this is the time to look after our most precious people in our communities. No one wants to end up on a ventilator. Our staff don't want to be looking after people on ventilators and in a life-critical situation. So please, everyone think about this every day. This is where you could end up. It's your mother, your father, your auntie, your uncle. And it scares me thinking about that possibility for my family. And so please, everyone, this is time to be really serious about stopping COVID in our region for our most vulnerable. Out of the patients in hospital, we've got 1 patient in Bathurst, 2 in Burke, 2 in Orange and 13 in Dubbo. We've got over 390 people in the care of our specialist community clinicians that are going into homes to provide care to both patients with COVID conditions and also other chronic and ongoing health conditions. We've seen that 5 people discharged or returned to the community free of COVID in the last 24 hours as well. Again, we've got a growing number of staff that are in isolation, 134 staff, with 21 of those through a workplace exposure. Now, these are staff that we want to be able to be caring for everyone in our community. This is the equivalent of around 40 patients that without these staff we possibly can't care for. And so if I can ask everyone to be really mindful of our healthcare workers, our precious resources. We'll care for you and your mother and father and everyone else when they get sick, and so that they're our most precious people. In the last 24 hours, we did see a significant challenge in Bathurst Hospital. Our emergency department had a patient come into the ED that didn't know that they were positive when they came in, but subsequently got diagnosed with COVID. Now that patient is now in the hospital and being cared for extremely well by our clinicians. They're not in intensive care because they're a really critical patient. That's our best space to care for them in. But the impact of that is that they potentially exposed other patients and staff to COVID. Now, we've done a lot of work to risk assess all of that, and we've got advice for all of our staff and patients that have that were in those spaces. But this is the risk that we do face every day, and so really want to do slow down COVID and keep our most precious resources protected. Vaccinations, again, a booming day yesterday, the biggest day that we've seen with ADF in our local health district clinics. Over nearly 1,800 people vaccinated. Around 13% of that was Aboriginal people coming in to get vaccinated. So can I say thank you to the Aboriginal community for responding to that call. We know that this is the perfect window of time for everyone to get vaccinated, particularly our Aboriginal community, where we know we've still got around 60% of the COVID cases in the region are in Aboriginal communities and people. Yesterday saw about 500 people in Narromine get vaccinated. Around 20% of those were Aboriginal. Parkes 450, Dubbo 547, and Burke 46. Now that was surprisingly really concerningly low. We've got a huge team of vaccinators and the ADF in Burke for the last 3 days. Today's the last day, and so can I please urge everyone in Burke, don't miss this opportunity. It is really urgent. Today's the best time to walk up, get a very quick vaccination. Both AstraZeneca and Pfizer are available both across the ADF clinics, the GPs, Aboriginal Medical Service and soon to be pharmacies in Burke as well. So the window out of this for us really is vaccination. The next 2 weeks are going to be crucial for us with the new pharmacies coming online, new GPs and Aboriginal Medical Services. Overnight we saw a huge volume of both Pfizer and AstraZeneca delivered into those primary care services from the Commonwealth, and so there's more and more coming in every day that will allow us to scale that up. The ADF and the AUSMAT teams that are here from the Commonwealth are here with the intent to try and jab as many people as we can right across the whole of the region, and so don't miss this window, please. Listen, I'll hand over now to Jeff McKechnie.
Thank you, Scott. Good afternoon, everyone. Just covering off on the policing issues for today. Firstly, Operation Stay at Home. Still that message not getting right through to everyone in the community. Around 110 infringements issued in the last 24 hours across the whole region. Here in Dubbo, around 35. I think we've come to a point where we seem to be dealing with a small group of people who, no matter what the message, no matter what the urgency, don't seem to care about their actions and the implications for that for the community. A number of young people in Dubbo last night thought it was a good idea to have a party. It wasn't. We're chasing people who are moving between our towns, COVID positive cases, thinking it's a good idea to go to the next town and associate with people there. Again, putting that whole community at risk. Scott mentioned Brewarrina, our COVID traces in the sewerage up there. I mean, someone in Brewarrina likely has COVID. And yesterday, in the last 24 hours, we issued 12 notices in Brewarrina. It's, and when we're dealing with those people, there just seems to be this lack of care for their actions and what implications that may have for the community. Now, we can keep writing out those notices all day long, but at the end of it, it needs to be people taking responsibility for their actions and trying to protect their community rather than put it at risk. So I'm kind of urging people today who have any influence at all in these communities around the actions of some of these people to try, please, to talk to them and to get them to understand the dangers that they're placing you, themselves, families, whole communities in, because the Delta variant of COVID is so easily transmissible, and that's what we're seeing. We're seeing big numbers now in Wilcannia, in particular here in Dubbo. It is so easy to spread this virus. So please, if you can at all, talk to some of these people, and people out there listening to me now know exactly who I'm talking about. So please have a chat to these folks, try to influence where you can positively. Now, we see some negativity on Facebook and on other social media. Some of the comments are just mindless, to be honest. The negative influence some people can have as well. Again, please think about what you're doing, think about your actions and how that might impact on the community. Our ADF health teams vaccinating people out there right across the region. Our program is running really well. We are flying our AUSMAT teams around the region every day to get these jabs into arms that Scott was referring to. It is our way forward. We've got a fantastic program in store. Please take note of where we're going to be over the next few days, weeks, and take that opportunity to get there, get either Pfizer or AZ, whatever it is, just please get vaccinated. It is our only way out of this problem in the longer term. Our emergency management arrangements are functioning really well. We're dealing with some strategic issues around accommodation. We're looking at places like Brewarrina, what we need there into the future, how we support health and our other agencies in the work they're doing. So plenty being done, and I'm happy to answer any questions anyone may have at this stage on the computer.
Thanks, Jeff. Could everyone who has a question specific to Jeff please raise your little digital hand? We've got one straight away from Jake McCallum from Dubbo News.
Thanks, Jeff. 3 officers COVID positive at Dubbo Police Station. How many staff are close contacts and in isolation?
I'm not sure of the close contact aspect of it, but we've actually taken the step of standing down one of our GD's teams, one of our general duties teams, that may have been working with those 3 officers or in contact with them. So probably, 8 or 9 others that we're looking after at the moment and making sure we get tested. But thankfully, at the moment, we've got additional staff in Dubbo to cover off those issues, and there's no shortages. The teams are running as effectively as they normally do.
So we do have the resources to cope with so many officers being in isolation?
Yeah, 100%. We've got 15 additional police in Dubbo, working in Dubbo at the moment, and with our ADF colleagues as well, we've more than got that covered.
Fantastic, thank you.
Thanks, Jake. Does anyone else have a question for Jeff? Does not appear so. Thank you very much, Jeff.
Thank you.
Bring Doug back forward. If anyone has a question for Dougal, could you raise your little digital hand for me, please? No one's raised their hand as yet. If anyone, Hamish, sorry, from Prime 7.
Hi, Dougal. What's our way out of this lockdown? Is there a set number of cases that we're trying to hit and reach? Or is there a target of vaccinations? Is there a goal in eyesight?
Look, there's definitely a plan, and there's a fairly strategic plan on what it will actually mean for our region. Clearly, it's two-pronged. One is staying at home and getting numbers to stabilise first of all and start to drop, and the other is the vaccination rate. And that's why there is such an emphasis that we are putting every day on getting to those vaccination clinics. There are areas that have the ability to get hundreds of people vaccinated every day that aren't necessarily doing that. That will possibly cause a problem in the future. But look, if we can get to that 75-80% people double vaccinated and we have numbers going the right way, then that's a really positive sign. Now, each scenario will be looked at individually at the time, but we've got 2 weeks now to say, stay at home and do the right thing. We know there are people that actively are doing the wrong thing. The police are trying to deal with that, and it's not a simple solution. We're trying to make sure that that doesn't impact the rest of the majority of the population that is doing the right thing. But as far as a way out, it's doing that. It's getting our numbers going the right way. I don't think there's a plan to get to zero anywhere. That seems fairly unreachable. But the plan to actually reverse the direction of the numbers and get vaccination rates to a level that's acceptable is exactly what we're trying to do.
Thanks, Hamish. Jake Lapham from ABC AFC Western Plains.
Yeah, hey Dougal. Just wondering, what's the level of concern about the Australian community services here? We've just heard about police officers. We know that there's a number of health staff. We're hearing reports of supermarket shelves not being restocked because of people in isolation. As this goes forward, are you concerned that that strain may become too much?
Look, there's a lot of work going on behind the scenes. Not all of it we can talk about publicly at the moment around planning to make sure that that doesn't get to that level, to be honest. So we know there are strains on all of our resources. Scott's talked about our health service providers. You know, we've got over 150 people that normally work for the health district being affected by this. We've got a few police, we've got lots of supermarket workers. We've got a lot of people around that are really frontline workers being affected. So there is some planning going on around the best way to manage that and make sure we don't have that as a constant problem. Some of that will revolve around testing. Some of that will revolve around the ability to be at work under certain circumstances. So there is definitely planning there. It's not a quick click your fingers solution. It's an ongoing one that does require a bit of support from all of the people involved in the planning, and that is certainly high on the agenda to make sure we don't come to a grinding halt.
Thanks, Dougal. Thanks, Jake. If anyone else has any questions for Dougal, you can speak up now if you'd like.
All good. We'll hand over to Scott.
Good. Thanks, Dougal. We'll run through one by one for everyone's two questions for Scott, starting with Tom Barber.
Scott, yeah, Dougal just mentioned it's sort of it's a bit unrealistic that the cases will get to zero. When do you sort of see the cases in the region sort of dropping below maybe 20 to 30 a day?
So I'd love to be in that place in around a week's time. We know that with the current cases and the number of people in isolation with them, we'll continue to see growth around the same numbers that we've been seeing. Yesterday was a record high for the 49, and typically we've been seeing the 25, 35 type figures that we've seen today. I expect we'll continue to see that for another week or 10 days, with hopefully a growing number of cases in home and in isolation. That's the secret number that we'll continue to look at, and decreasing the number of people that are infectious in the community. Now that all relies on us doing all of the things that we talked about, all of the social distancing, hand hygiene, wearing of masks, checking in with QR codes, and just staying at home whenever possible. Those are the things that will help us decrease the number of people infectious in the community, along with getting tested really quickly. If you've got any signs and symptoms, get tested immediately. Don't stuff around. You could be the next super spreader in our region.
Thanks, Tom. Did you have one more?
Yeah. Is it a bit concerning that you mentioned before the testing numbers have dropped by that 2,000 per day? Is that a bit concerning?
I think sure is. We know in Dubbo, with hundreds of cases in the community, some of those have been active in the community in the last 1, 2, 3, 4, 5 days. We know that there's potential for further spread in Dubbo and the surrounding communities. So please, there's some real urgency to coming and getting tested. The lines are short, the turnaround times are getting quicker. I know there's some concern about long turnaround times still. We're continuing to work on those. We do have some more fast turnaround testing times, and in particular the histopath service in Dubbo at the showground has really quick turnaround times. 90% of those are coming back within 24 hours.
Very good, thanks, Tom. Let's move on to Hamish Southwell from Prime 7 Dubbo.
Hi Scott. Are you truly confident we can get on top of the cases with the lockdown extension? And is there not a need to tighten restrictions instead of lengthening the lockdown? Especially given Dougal's just said at the start of the press conference that Dubbo's the heart of the concern.
Well, I think you've just heard from Jeff. There's still too many people moving around, so that tells me that people just aren't doing the basics of staying at home. People that are driving between towns, leaving homes to go to a party, it's just unconscionable at the moment. So this is the things that's putting risk in our community. It's putting at risk all of our elderly, all of our most frail and vulnerable people in our communities. And so the next 2 weeks are just about doing the things that we're being asked of. It's staying at home, it's keeping apart from each other, it's doing all of the things if you do need to go out to protect yourself and protect the whole of the community. So I'm confident with those things we can get on top of this, but it relies on everyone doing the right thing.
Scott. Thanks, Hamish. Let's move on to Jake Lapham from ABC Western Plains. Jake may have left. Jake McCallum from WA News has left as well. So let's go Tom Corrigan, Prime 7 Orange.
Hi, Scott. Sorry, I'm in having lunch. 1 second. Sorry.
That's all right, Tom. It's our time.
You're right, Tom. You ate your
I'm
lunch.
good. I'm good. I'm good. I'm good, mate. Scott, not to digitally meet you. I don't know if we've spoken before, but I wonder if you can clarify something for us. So, in the 11 a.m. presser about an hour and a bit ago now, Brad Hazard said that only get a test if you have symptoms because the strain is too much and the workload is too much, and that's why we're getting a massive delay on test results. Should we be following those instructions, or is it better to keep getting tested? Because only 91 testing Forbes is pretty bloody low on every case now. So should we be following Brad Hazard's advice, or is there something better that you would advise the public?
Well, the advice has always been get tested if you've got any mild symptoms, however mild, a little scratchy throat, a sniffly nose, a little bit of fever, an upset stomach. All of those conditions are the signs that could be COVID. And so that's always been the advice. Nothing's changed in that. If you've got any concerns that you've been in a location of concern, then please come and get tested, isolate and stay at home and follow all of those advice. And so the advice is consistent. The testing times are quick. The result times are coming down. We'll continue to invest in newer technology and getting everything faster and faster. I know that's been frustrating for some people across the region, but just because you've been tested once doesn't mean that you're free of COVID forever. You could have been starting to become infectious when you were tested early, but didn't show up on the test. And so if it's 2 or 3 days later, then don't hesitate to come back and get a further test. If you've got any symptoms, however mild, anyone across the whole of the region, that's the time to go and get tested.
And if I can just ask one more follow-up, if I may, would the same rules apply for essential workers who, some are being instructed to get a test every 3 days, regardless of symptoms or not? Should they, let's say, not get a test to lessen that workload on the testers themselves?
No, those are the crucial things. The regular testing of people coming into our region, construction workers or other transport people or others that are coming from another hotspot that are required to get tested every either 3 or 7 days, depending on where they've come from. Those are crucial. Don't ever compromise on that. And for everyone else across the region, this is the time we can't compromise. Any symptoms, however mild, then come and get tested.
Cool. Thanks, guys. Thanks, Benny.
Thanks, Tom. Jake Lapham from ABC Western Plains has just rejoined us. Do you have 2 questions for Scott?
Yes, sorry, thank you. Does the Brewarrina Vax Clinic have AstraZeneca? And secondly, the Narromine Hospital upgrade, when will that be up and running?
Sure. So in all of our towns, we've got both AstraZeneca and Pfizer available, either through local health district clinics, the ADF pop-up clinics when they come into town, the GPs, Aboriginal Medical Services, the pharmacists, and the respiratory clinics. Now, there's a lot of those around the region. There's a lot of new pharmacies that are coming online just overnight and kicking off in the next week. There's a big volume of supply coming in from the Commonwealth overnight as well, and so I can ask everyone to come and look for opportunities to get vaccinated as quickly as possible. I know in Brewarrina, the Aboriginal Medical Service and the GP practice have both been vaccinating for some time, and so please come and look for those opportunities in Brewarrina.
Jake, did you want to just retouch on that Narromine Hospital aspect?
Yeah, sorry, thanks. Yeah. When will that be up and running, and will any other hospitals potentially be included in that going forward?
Sure. So we're continually expanding our ability to care for patients with COVID in a number of our communities. Narromine is a big step forward for us in wanting to make sure that for patients both from Narromine and the surrounds, but also extending right up north to Burke, Brewarrina, Cobar, Walgett and those communities, if we do need to get people close to Dubbo, they don't need intensive care support yet, but they might need that at some stage, then Narromine's going to become in the next week our critical point to support people and save lives. And so I really do appreciate the understanding of the Narromine community and surrounds that this is a critical step we've needed to take. It's with the best intentions to look after everyone in the community. We do still have the ability for people who need to come to the emergency department. Please don't delay coming to the emergency department. There's separation from the rest of the facility, and we'll still be able to provide you care.
Scott, thanks, Jake. Let's move to Renee from Forbes Advocate.
Hi Scott, with our Forbes case, I was wondering what you can tell us about them. Do we know the source of infection, and do we know with them whether they have been infectious in the community yet?
Sure, Renee. We're still undertaking investigations into the new case in Forbes, and they'll continue in the next 24 hours. But we know that there's a connection there to the parks community, and the communities are so closely linked, and people travelling between them on a very regular basis. And so I really would urge everyone to be really cautious. If you've got any signs and symptoms, however mild, in parks, Forbes and the surrounding communities, please come forward and get tested. The testing lines and access is very short, and so please don't delay. We know that this person was infectious in the community, and so please everyone be on guard. Any signs and symptoms, come and get tested.
And similarly, for the same message for the parks community, I guess it sounded as if the source of the new parks case was not known yet.
We're still doing the investigations for the new case that's in the parks local government area. It's in the broader community, and so everyone in the whole of the region, any of our communities, any day of the week, could have someone standing next to you in the line in the supermarket, in the service station. It could be you, it could be your kids, and so please don't mess around with COVID. It could be spreading anywhere in any town.
Thank you, Scott.
Thanks, Renee. Let's move to Oliver from the Canberra Times.
Hi there, Scott. My question first up, just was wondering if you could provide a bit of an update on the currently active cases in Golargambone and the rest of the Canberra Shire.
As far as I know, both the cases are still being cared for in the home. No doubt that there's people in isolation and families in isolation with those people, and so this is time for us to all show some love and understanding for people across all of our communities. Getting advised you've got COVID is a pretty scary thing for anyone and for the families around it, and so please, it's not time for social media attacks. It's not time for people to want to know every detail about everyone, where they've been, what they've been doing. The numbers aren't the important thing. How we care for people and come together as a community is just so important at the moment.
Great, thanks for that. And my other question surrounds with the Canberra Township, where all the vaccination and the testing is going, being half an hour away from the Golargambone Township. Are there any additional testing or vaccination opportunities being planned for Golargambone now or in the future?
We have had testing just recently in Golargambone, and vaccination I think in the next couple of days, or it's this week anyway, and so that there is opportunities in Galar right now. Please don't hesitate if you've got any signs and symptoms. We'll continue to look for opportunities to increase the testing in a lot of our communities.
Thanks, Scott.
Thanks, Oliver. Tanya from the Central Western Daily.
Hi, Scott. In terms of the 3 cases in Orange, do you have any more information on those, whether they're connected to the previous cases or if they were out in the community?
Listen, I can tell you all 3 of those cases have been in isolation and not in the community infectious, and so there's some good signs there that the things that we're doing to keep everyone safe are working. These 3 new cases overnight weren't infectious in the community.
Thank you, that was everything from me.
Thanks, Tanya. Bradley from the Western Advocate.
Hey Scott, I just wanted to ask about the 2 cases in Bathurst. We heard reports that one of those cases might have visited the ED up at the hospital. We want to know whether you can confirm that or not, and whether that's had any effect on the staff up there.
Sure. So we did see one of the new cases that's been diagnosed in Bathurst come into the emergency department for some care for another health issue. While they were in our care, we ran a rapid test and were subsequently diagnosed with COVID. Now, there's a number of both staff and other patients that have been in the service that have been advised to either go into isolation or watch and be aware of any onset of illness and concerns around COVID.
Yep. You're not sure on like an exact figure of how many staff or patients that would have to isolate?
No, I haven't got exact figures on that, no.
That's right. And I just want to ask about, you mentioned something about the home testing service when you were talking about Kelso earlier. Can you explain a bit more about that? I assume it is what it is. You get tested at home, but are you able to explain just how the process works, how someone can get tested at home?
Sure. So we'll be setting up in coming days a home testing service that we want to make sure is prioritised for vulnerable people that really can't leave home and get to a testing location. We've seen low numbers of people coming to the Kelso walk-in drive-through testing clinic, and so we're really concerned that there may be people not able to leave their homes and wanting to set up that service. We'll have advice in the next 24 hours on how that service will operate, how to access it, but it is intended for really people that can't leave their home to get tested.
All right, thanks for that.
Thanks, Bradley. Maggie from the Parks Phoenix.
Thanks, Scott. Just on the new case in Parks, was the person infectious in the community, and is there any relation with the previous cases?
Thanks, Maggie. So yes, the new case in Parks was infectious in the community. Again, it's a message for all of us. We can be standing next to a person that's infectious, or it could be you. And so please don't hesitate to come forward and get tested. I really would encourage the whole of the Parks community. We know that in the last week, the vast majority of the cases we've identified have been infectious in the community. Look at the locations of concern on the New South Wales Health website. Follow the advice that's on there, whether you need to get tested and stay in isolation or get tested until you get a result. But regardless of that, come and get tested if you've got any signs and symptoms, however mild.
Thanks. And can you just confirm, did you say 450 people yesterday vaccinated in Parks?
Yes, there was.
Yeah. Okay. So that was an increase from Tuesday?
Yes, that's right. Yeah, so there was a big lift in the number of people at the ADF and our vaccination team were able to vaccinate yesterday. So it takes it to over 750 people across the 2 days. And so please, everyone in Parks, don't miss the window of time to come and get vaccinated quickly and easily.
Thank you.
Thanks, Maggie. Let's move to Joanna from ABC Central West.
Hi, Mr. McLaughlin. Just with regards to the case in Forbes, we have been told that all staff at the Forbes Medical Centre have had to be COVID tested because of a potential breach with someone coming from Mudgee to visit a staff member at that medical centre. Do you know anything about that?
No, I don't have any information on that, Joanna, sorry.
Do you know if the patient is connected to the medical centre in Forbes?
No, I don't believe so, no.
My second question is with regards to the capacity of health services. So you mentioned the number of people in hospitals, in the region's hospitals, and in ICU and on ventilation. How do you think, or how would you describe the capability of the health service, the LHD's health services at this current state, given the number of cases we're getting each day? Is it feeling the pressure yet, or is it coping?
Well, so we're definitely coping. I mean, we're in the middle of winter as well, and so we know we've got a lot of people that need care with other health issues, not just COVID. The small number of patients that have COVID in hospitals at the moment, a very small percentage of our total acute beds and our ability to care for people across the whole of the region. In the last 10 years, we've seen nearly all of our hospitals and health services totally rebuilt. We've seen Dubbo just go through a $250 million redevelopment and more happening at the moment. And so we've got some brand new facilities. We've got some of the best world-class clinicians in our region, and so we're definitely up for the challenge. The one thing I would say though is with a growing number of our staff off having to isolate, that's the biggest risk for us, that's getting the workforce. And so if everyone can really think about the impact of that, wherever you go, thinking about the impact of health staff not being able to care for your mother, your father, or aunties, uncles and cousins, if they're not at work. We know that out of the 140 odd staff that are off in isolation at the moment, that's around 40 patients a day that we can't possibly care for without some of those staff. And so our workforce is stretched. We know that we're going to need additional workforce, and we'll have a campaign out in the next 24 hours to help us find anyone that's willing to come and help out.
Thanks, Joanna.
Sorry, thank you for that.
That's all right, thank you. And finally, Cam Gorley from Fairfax Media. You got 2 questions for Scott.
Hi, thanks, Scott. Look, you discussed it earlier when you thanked the Aboriginal community for going out and getting more jabs. but has there been a significant update in yesterday's numbers that you gave regarding the Indigenous population percentage-wise? About 6.3% have been double vaccinated compared to 26% for the general population in the health district. Are those numbers still the same? And also, how many cases have been in Aboriginal people of this current outbreak? You said about 60%, but is there a firm number?
Sure. So we know that vaccination is going to be the solution for all of us, and in particular the most vulnerable in our communities. And so it was pleasing to see yesterday through the pop-up clinics and our vaccination hubs, about 13% of the total number of people that were vaccinated were Aboriginal community members. And so thank you to the Aboriginal community. In Narromine, that was about 20%. And so there's a great step forward in helping to increase the rate of number of Aboriginal people vaccinated across the region. I don't have new details yesterday compared to today. We'll do that on around a weekly basis to help us understand what progress we're making and where the target or the goal is and how far away that is from us. So we do want to say, though, there's some real urgency to coming and getting vaccinated, particularly in Dubbo. The ADF pop-up clinics are here until Sunday this week. We haven't seen a big number of Aboriginal people, particularly in Dubbo, come to get vaccinated. So there's some urgency. Don't miss out. The opportunity to walk up and get vaccinated very quickly. Both AstraZeneca and Pfizer are available, and the AstraZeneca lines are so short you can skyrocket your way straight to the front of the line and not have to wait. So please don't hesitate. For the whole of the Aboriginal community, now's the time.
And look, in terms of the vaccination rates being about 6.3%, despite being a priority group compared to 26% for the general population, why do you think those numbers are as low as they are? Is hesitancy an issue? I mean, what are you seeing and hearing on the ground?
Well, I actually think there's been a lot of misinformation around some of the social media stories that the anti-vaxxer groups that come out and just spew lies. But they tell absolute lies of the evidence around vaccinations, the effectiveness, and honestly, I wish they'd just stop. I wish everyone could help them stop, because the concerns that have been created unnecessarily, the fear of getting vaccinated is so unwieldy. So can I ask everyone, look at the evidence, look at the information that's around. Both AstraZeneca and Pfizer are very safe and effective vaccines. They're readily available. There's a lot of opportunity to get vaccinated. And so please, everyone, don't listen to some of the scaremongering and rumours on social media. The real information is they're available, they're safe and effective, and the time's right now.
Thank you.
Thanks, Cam. Hamish, you have one more. Good time for that one.
I do. Thank you very much, mate. Appreciate it. Scott, are you able to confirm, police have just notified us at Prime that there are 9 cases in Bathurst and 2 in Lithgow as of 9 a.m. Are you able to confirm this and places that people can get tested as well?
Sure, happy to confirm that there's a total of 9 cases in Bathurst. I don't have the figures on Lithgow, it's outside of our region, but regardless of whether it's 2, 9 or 50, the issues are the same for all of our community. COVID can be circulating around any household, any street and any shop. And so please don't get hung up on the numbers. It's all about the risk that everyone in our communities have, that the things that we can do to stay safe, staying at home, keeping apart from other people and using all the protection is the most crucial things. If you've got any signs and symptoms, then please come and get tested quickly. Don't mess around. The 2 or 3 hours that you wait from when you start to have a sniffle could be the time that you spread to 10 other people. And so please don't ever hesitate coming and getting tested, and please everyone just stay safe.
Perfect. Thanks, Scott. Thanks, Hamish. And thank you all for attending again. We'll get the recording of this one out as soon as we possibly can.